Today, I'm going to convince you that the nation's gravest and greatest health crisis is not what you think it is. It's not homelessness. It's not sex trafficking. It's not substance abuse. It's not crime, incarceration in prisons. The gravest and greatest health crisis in this nation is something that you don't even hear about, or if you do, you hear about it rarely. I'm going to talk about it. Stay with me. There are symptoms to this problem that we are all talking about. They make the headline news and they make our cities and our communities less safe. And chances are you or a loved one has struggled with them. Today in the US, we have nearly 600,000 people who are living homeless in the richest nation in the world. Sex trafficking, nearly 9,000 people are rescued each year. This is sex slavery in the United States of America. Academic failure and teenage pregnancy, which inevitably, in most cases, lead to poverty, which is a systemic issue. Suicide, which is the second leading cause amongst minors between the ages of 13 and 19, and the leading cause of death today amongst 13-year-olds in the United States of America. And then crime, incarcerations, and prisons and rehabilitations. Check this out. While the United States represents about 4% of the world's population, we imprison nearly 20% of the world's prisoners. But again, right now, I'm talking about symptoms. I'm talking about symptoms in the richest nation in the world, but I'm not yet even talking about the cause. So there are three parts to the cause, almost like a stool. They are all real, they are all viable, and they all need to be addressed. I'm going to go quickly through all three of them. In 1962, there was a groundbreaking paper called the Battered Child Syndrome. And for the first time in our nation's history, people started paying attention. Major news outlets started reporting what was happening with child neglect, child abuse, child abandonment, and Congress responded. By 1967, all 50 states, for the first time in our nation's history, had what we call mandated reporting laws. If a teacher saw a student that had a black eye or that looked disheveled, skinny, etc., the teacher was required by law to report the child to protective services or to the police. So we all have heard of child neglect, child abuse, and child abandonment, and that is the event. Think of child abuse, if you will, or child neglect as a certain event that happens, it might have happened to you. But that's not ultimately what the problem is. It's part of the problem. The second leg is childism. Think of racism, think of sexism, think of childism. Some of you are going to resist this. Some of you are going to say, wait a second, we do not discriminate against children in the United States of America. Nobody does. We know that some parents feel that their children belong to them, hence they are able to do and freely do to their children whatever they would like. Now, of course, that's not the majority of the population, but like any ism, you have a collective mindset. And in this case, we all fall prey to this reality, which is undeniable. According to UNICEF, child well-being reports rank the United States lowest amongst first world nations. And the US has the highest rates of child abuse in the world. So right here in the US, we rank lowest amongst all nations. This Christian nation, this civil nation, if you will, treats its children collectively worse than any of the major nations in the world. And in my next episode on this topic, I'm going to talk about this complex idea called childism, which ultimately is the cause, and it affects parents, it affects members of Congress, it affects law enforcement. It's a systemic issue that we have to at least talk about. And finally, we have trauma, which is a word we hear a lot about. Technically speaking, what we're referring to when a child is abused or neglected is developmental trauma. Recently, in the last few decades, there's been a term called ACEs for adverse childhood experiences. I'll talk about that in a second. I prefer to use the daunting term, family-induced childhood trauma, because ultimately what we're talking about here, overwhelmingly, is not the type of trauma a child endures with, for example, bullying at school. We're talking about a situation where the person who was supposed to be the one to provide basic safety, basic care, basic protection, basic nurture, becomes the one who is the perpetrator of the trauma. There's so much that could be said about trauma, but in this video, I'm going to quickly just hit some main bullet points. So in the 1990s, the Kaiser Foundation and the Centers for Disease Control got together and conducted a massive study of nearly 18,000 adults. And they asked them 10 questions. And I'm putting the questions on the screen. You could look at them. Many of you could identify with these questions. And essentially what happens is the more an individual says yes to these questions, the higher their score is. But a high score in this case is not a good thing. And you could see from some of these slides the direct correlation between higher ACEs scores from more trauma and poor outcomes in an array of areas. And I'm just brushing on it. There is an exponential increase of self-destructive behaviors and other types of outcomes that are correlated to trauma, to childhood trauma, but more specifically to family-induced childhood trauma, most specifically trauma where a parent becomes the one that is the perpetrator. So why would it be called the nation's gravest? And I want to quickly say, just think with me, if you will. And we're not doing kind of poverty Olympics here, but let me give a relevant example. There's a war in the Ukraine, and God help those mothers and fathers and children who are fleeing into Poland. But in a case like that, take an example of, say, an 8-year-old child, and bombs are going off. There's tons of uncertainty and fear and terror in the heart and the mind of these children, which is traumatic. And I am not trying to get away from that. But in these cases of, say, war, take what happened in Syria, the second largest humanitarian crisis in the world after World War II. These children have a parent, or they have a grandparent, or they have both parents, or one parent. But they have that thing that was supposed to be embedded in humanity and, frankly, in the animal mammalian kingdom, which is a parent who provides basic stability, basic care, basic love. Children can't process trauma. Their brains can't do it. They're not ready yet. And so what a parent does, and many of you know what I mean on far less insidious things, is we're able to say to our child who might wonder what's going on with a riot in a certain state and might be afraid, we're able to say, Johnny, sometimes people get upset and sometimes people break the law, but it's okay. We're safe. Like, that's what we do. That's what parents do at the most root, at the most innate sense. With family-induced childhood trauma, and you know where I'm going, the person who was supposed to provide that basic soothing, that basic explanation, that basic protection, becomes the one that abuses and neglects the child. Where does the child turn? And most of this happens in secret. Most of this happens behind closed doors, which is part of the problem. It's the gravest issue because after spending nearly 4 years running an amazing organization called For the Children, that work directly with children with state government across the nation and in other countries, I saw a lot of this firsthand, and I'm going to end with a story. Not firsthand, but firsthand reporting. It's prevalent, it's insidious, and it is the nation's gravest health crisis because nothing could be more painful than be locked in a home with a caregiver, a parent, that neglects, abuses, and potentially abandons you. It's the greatest health crisis by virtue of number. In 2015, the National Institutes of Health tried to put a dollar amount on the effects of family-induced childhood trauma, ACEs, child maltreatment, whatever you want to call it. They tried to say, how much does this cost our nation? We know that law enforcement kind of is involved in this quite a bit. So are our courts. So is Child Protective Services, social workers, the cost to society, communities, et cetera, et cetera, et cetera. Rehabilitation, it costs a lot of money. They determined that it costs us $2 trillion a year as a nation. To put that in perspective, that's 3 times the amount that we spend each year on our national defense. We spend more money internally trying to deal with the reality of family-induced childhood trauma than we do trying to protect our country from outside forces, outside invaders. That's how costly it is. So it is the gravest health crisis because nothing is more damaging or disturbing than a parent neglecting, abusing, abandoning a child, and nothing costs our nation as much in terms of health as this issue. Costs more than heart disease, costs more than cancer combined. So why don't we hear more about this? We hear about other great disasters, hurricanes, shootings, wars, riots, which we should hear about them. In 2019, the CDC revealed that 5 children die every single day in this country because of child neglect and child abuse. That's a Sandy Hook school shooting. Every 6 days in this nation, every week, every single week, 30 kids are dying, and then 30 kids are dying, then 30 kids are dying. Imagine if that was a school shooting every week. 30 kids. 30, then 30, then 30, then 30, then 30. That's been happening in this country for years. You hear nothing about it. The media focuses on what we could refer to as inflection points. Big things that happen like a hurricane, like a bombing, something we can see because they're dealing with sensationalism. And I'm not criticizing it. I'm just saying when we can see something with our eyes, like kids running out of a school, or hear things with our ears, like bombs going off, we connect more with them. The children we're talking about live in hiding. We cannot see them. We see more reference to abandoned and neglected cats and dogs, frankly, than we do abandoned, neglected children. And we have to because we cannot show those children they're minors and they're being hidden by their parents. I'm all for adopting cats and dogs, by the way. That's not a comparison. It's just to say, how could there be more awareness, perhaps, of cats and dogs who are neglected and abandoned than children? Despite the huge progress, we have 500,000 children nearly living in foster care today, and far more than that who suffer from neglect, abuse, and abandonment, and who were never reported. The government can only do so much. They do what they could do. The author of the Battered Child Syndrome in 1992 said this in an interview. He said, "One day last November, we had 4 battered children in our pediatrics ward. 2 died in the hospital and 1 died at home 4 weeks later. For every child who enters the hospital this badly beaten, there must be hundreds treated by unsuspecting doctors. The Battered Child Syndrome isn't a reportable disease, but it damn well ought to be." And the point there is this is going on all the time, and yet it doesn't garner the same attention as other important issues. But again, here we're talking about children. Last year, a social worker, and this is one example of thousands, said, "With an ever-increasing caseload, I was stretched so thin that I often questioned what difference I was really making. I was running on empty, the stress and exhaustion robbing me of peace. Even in my personal life, I worked evenings and weekends just to keep my head above water." That is the reality for many social workers who are trying to pick up the pieces. What about medical professionals who are trained to treat physical and emotional illness? Well, today when a child displays symptoms, emotional symptoms, symptoms of trauma, often they're diagnosed with psychiatric disorders such as depression, oppositional defiance disorder, ADHD, anxiety, and more than ever, they're prescribed psychotropic agents. Today, we have roughly 6.5 million children who are on psychotropic drugs today. Yes, these drugs help in a way, but they also curb a child's ability to feel pleasure, to be curious, to grow emotionally and intellectually. When I would attend our camps, I remember the first one I attended, on the third day, I finally asked someone, "What's this long line in the morning and at noon or something, or in the evening? Long lines, 30, 40, 50 children between the ages of 6 and 12." It was the children getting their meds so that they could cope with the trauma that they had received. And what about the nonprofit organizations? This is something I'm passionate about. We have tremendous nonprofit organizations in this country, and many of you watching this probably give money to them, probably serve on their boards, volunteer. I'm all for all of them that are doing good, but too often the organizations are focused on rehabilitation versus prevention, helping the drug addict, helping the homeless, helping pick up the pieces after the symptoms of the trauma appear in life. Prevention is much more difficult work, and yet there is great hope in the area of prevention. So ultimately, the burden falls on individuals and organizations willing and able to work on the preventative side. And in the show notes, I'm going to put just a list of a few organizations that I've had the pleasure and the joy of working with. These are legitimate organizations. These are organizations that leverage every penny they have to help these children. It's not exhaustive. I'm leaving some out. But in the notes, you can go down there and you can access some of these organizations. I'm going to put For the Children in there as well. They work at one of the primary ways of helping these children, which is mentoring. Because one of the best things you could do for a child to improve his or her outcome, and it's really simple, but you've heard the story before, is to put one of those children next to a caring, loving, stable adult. That's what For the Children does. And you've heard these stories before without any organization. I mean, Simone Biles, she had a mother who was a drug addict, abandoned her a few times, and Simone Biles was taken in. And we've heard the story before. My mom was never around. My dad was never around. My dad was an addict, whatever it might be. But I had an uncle. I had an aunt. I had a grandparent. I had a coach. All it takes is somebody to believe in these kids. And so there is great hope. And please go to those notes and get involved. During my second year at For the Children and taking in all this research and really in many ways grieving the gravity of the gravest and greatest health crisis, or coming to be aware of it, I read a statistic that somewhere between 60 and 80% of children that go into sex trafficking are coming out of the foster care system. And I was visiting one of the For the Children camps in the Bay Area of California. And it was the first day, and all these children were there. There were maybe 50 of them, and they were watching this video that all the kids have to watch on how to be safe at camp, very strict guidelines. As I was looking at these children, I was thinking of that statistic. And I was looking at the young girls, again, between the ages of 6 and 12, and the average age that these girls become compromised with forms of sexual abuse is 12. And I started to weep. I did the math and I thought of these 30 young girls here, 20 of them are going to end up as sex slaves in one way or another. And so we started a program, a national program at our different chapters around the country. And we just taught the young girls and boys in an age-appropriate way how to identify a sex predator, and that these kids could have a voice, that they would be safe if they spoke up. And we had a young girl, I believe she was 8 years old. This was last year in Nebraska. She came to one of our programs and listened to the advice of the counselor, and she decided to be brave. And she spoke up, and she talked about how she was living in a trailer that was a meth lab prostitution trailer, and how her uncle had been sexually abusing her and asking her to send him inappropriate pictures. And she spoke up, and now the uncle is out of the picture. And the reason I bring that story up is, aching as it is, it's also beautiful because this girl is now safe. This young girl now knows she has a voice. And that voice doesn't end with her. It will most likely translate to her own children and her children's children and anyone else around her. And so there is great hope. And I ask you, again, to go to the notes, reach out to me. This is something I'm passionate about. This isn't a day job for me. This is something I'm doing because it's our nation's gravest and greatest health crisis. And we're all in this together. Determine your role, and also stay tuned for my next episode that'll get into this thorny idea of a kind of collective, if you will, responsibility we all play